I'm joined today by Dr. Ted Love, the CEO of Global Blood Therapeutics. And Dr. Love is here to talk with us today about a topic that's been coming up a little bit more and more frequently in the past few months on our site, at least in terms of our coverage and the discussions we're having with sickle cell disease experts. And that is exactly how disparity is affecting the hematologic condition patient population, how it has been, and where we're getting to in terms of resolutions and what exactly it's going to look like when we've reached a solution on that front. But first and foremost, Dr. Love, how are you doing right now?
I'm doing well, Kevin. Thanks for having me on.
Thank you so much for being here and just your interest in the topic and the expertise you're going to be sharing with us. And maybe we could just start as broadly as possible. I think it's always great to ask experts if they can give their personal definition to the great issue before we get into it. So if you could define exactly what disparity looks like in sickle cell disease, how would you go about that?
Well, I would go about saying that sickle cell disease has historically suffered disparity at every level. And we can start with investment in basic research. We can move on to investment in clinical research, invention of therapies, and even putting together quality treatment infrastructure like we've done for many diseases, like cystic fibrosis, where we have really major cystic fibrosis centers of excellence all around the country. We've not done that for sickle cell disease, even though it's 3 to 4 times prevalent. We need to be doing those kinds of things to make sure that sickle cell patients are getting equal attention at every level. We've been failing at every level heretofore.
Wow. And if we could talk a little bit from your personal perspective of, in your work as a clinician, I guess, what was your firsthand experience with it? Is this something that, for as long as you've been in medicine has just been a well understood issue and just hasn't had the means to be addressed properly?
Yeah, it's an interesting story in that I grew up in the segregated South. So I was around Black people all the time. I'd never heard of sickle cell disease. And my first real interaction with sickle cell disease was when I was a medical student at Yale New Haven Hospital. And I saw the patients. Obviously, I recognized that they were primarily African Americans. About 95% of sickle cell is African Americans in the United States. And my observation was that not only did we not have good medical therapy to offer them, we were actually not very kind in terms of how we treated the patient. A lot of assumptions about their motivations for coming to the hospital in terms of drug seeking, for example. It was really sad. And that's in part of why I got involved with GBT. I felt that this was an opportunity for me to lean into a problem where there had been historically the lack of attention. I thought I could personally put my effort into putting attention to this. And we built a company, GBT, which is very focused on making sure that we do our part to make lives for sickle cell patients as good as we've done for other patients.
And it's great and very interesting, Dr. Love, that you reference, of course, the fairness of care that the patient perceives when they come in. And certainly with a condition like this, that's so high stakes that initial encounter goes very well. And it reminds me of a recent study, at least that I looked over, discussing the fact that a patient with a usual care physician that is familiar with sickle cell disease, far more likely to report a positive experience and adhere to their treatment and come in for a follow-up visit versus someone who may be reporting to the ED with more emergent issues. And I guess that's a deepening concern, and it kind of butts against the notion that that work needs to be done to make sure that patients adhere and educate themselves on these matters when their instances of interaction in the healthcare community is a negative one. I was just curious, what are your thoughts, and maybe what are GBT's thoughts on exactly, I guess, our physician presence and availability and resources to provide to the patients?
Yeah, physician availability is actually one of the major issues, and it's not accidentally. We've actually created this problem. We do not pay physicians properly for treating patients that are on Medicaid, for example. And if you don't pay physicians appropriately, then that's effectively a disincentive. 50% of the patients in this country with sickle cell disease are on Medicaid. And that's unfortunate. And we really should correct the disparity in how physicians are compensated for treating sickle cell patients. One of the facts that I was shocked by when I got involved in sickle cell from GBT is 70%, 70% of adult sickle cell patients do not have a specialist.
Wow.
And I think to myself, could you imagine being a cancer patient in the United States and 70% of the time you don't have an oncologist, or having a serious heart disorder and 70% of the time you don't have a cardiologist? But we've created this problem, and we do have a lot of dedicated physicians and healthcare providers that are focused on sickle cell for the same reasons that I'm focused on it. But we need to get rid of the disincentives, and we need to really pay physicians and healthcare providers and health centers appropriately to provide excellent care for these patients.